There's a 5-year gap in global life expectancy between men and women, and it's actually getting wider. Now, this is a huge problem that affects fathers, brothers, and sons everywhere. But what if a key part of the solution isn't in some high-tech lab, but right around the corner at your local pharmacy? Let's dive in and see how. All right, first up, let's really wrap our heads around the scale of this problem. We're not just talking about numbers on a chart here. We're talking about a pretty significant and growing health gap. That means millions of preventable, premature deaths for men all across the globe. The numbers really are stark. A 5-year difference. To put that into perspective, that means 1 in 4 men won't even live to see the age of 65. And this isn't just happening in one place. It's a consistent pattern we see everywhere. So that's the big question, right? Why is this 5-year gap so persistent? Well, it turns out the answers are a pretty complex mix of biology, our behaviors, and even our culture. And this breakdown is really revealing. Get this, biology only accounts for about 1 year of that 5-year gap. The other 3 years, that's a staggering 75% of the difference. It all comes down to factors we can actually change. We're talking about things like lifestyle habits and, crucially, a reluctance to go get medical care. So what are these modifiable factors really causing? Well, they lead to higher rates of conditions that are preventable, or at least manageable. Think about things like heart disease, diabetes, mental health issues, sexual health problems. And the key word here really is manageable. These are the exact issues where getting help early and consistently can literally be life-saving. Okay, so if these conditions are manageable, why aren't more men getting the help they need? This brings us to the hidden barriers, all the complex reasons that keep men away from the doctor's office and, as we're about to see, their local pharmacy too. An expert in Lebanon put it perfectly. They said, in the mind of people, men are strong. They cannot cry, they cannot be depressed, they must be stoic. This idea of stoicism is such a powerful cultural force. It basically teaches men that asking for help, whether it's for physical or mental distress, isn't just unnecessary, it's a sign of weakness. And these cultural norms, well, they create very real barriers right there at the pharmacy counter. There's the discomfort, of talking about sensitive topics, a lot of the time with female pharmacists. Sometimes there's just a simple lack of awareness of what services a pharmacy can even offer. And, of course, there are worries about privacy. It all just combines to create this perfect storm of avoidance. But here's the thing. What if the very place men are avoiding actually holds the key to solving this whole problem? The answer to closing this health gap might just be hiding in plain sight. And that brings us to our unlikely hero in this story, the community pharmacy. It's in this totally unique position to become a critical touchpoint for improving men's health, and it's all because of how accessible it is. I mean, think about it. Unlike a doctor's office, you don't need an appointment, there are no long waiting times, you don't have to take time off work, you can just walk right in. Pharmacies are literally designed for convenience, and that simple fact removes so many of the biggest hurdles to getting care. Now, there is a key dynamic we have to consider. Up to 80% of the pharmacy workforce is female, and for some men, that can be a barrier. But look, this isn't some insurmountable problem. In fact, just acknowledging this reality is the very first step toward designing strategies that actually work around it. So, let's look at what's actually working out there. How can pharmacies around the world actively start to engage men and make them feel welcome and, supported? Just listen to this from a pharmacist in the UK. We do blood checks in the pub. We go there not to get the result, but to break the barrier. This quote just perfectly captures the core of the best strategy. Meet men where they are. Go to the pub, the gym, the barber shop. It's not just about getting a blood pressure reading. It's about building trust in a familiar place. It's about breaking down that barrier before a guy even thinks about stepping foot in a pharmacy. And once they're inside the pharmacy, small changes can make a huge difference. Prominently displaying men's health products, using clear signs that point to private consultation rooms, maybe offering more flexible hours. Each one of these things sends a signal that this is a space for them too. It's all about being intentional and creating a more inclusive environment. An even more powerful strategy is to think long-term, to take a life course approach. This is all about building a relationship that evolves over time. Maybe it starts by engaging a young man about fitness supplements. Then you're supporting him with his family's health when he becomes a father. Later, you're introducing chronic disease screening in midlife. And eventually, you're helping with medication management in retirement. Every stage just builds a foundation of trust for the next one.
And we're already seeing these really innovative collaborations happening. In the UK, barbers are being trained to do blood pressure checks. Pharmacists are setting up shop in gyms to offer advice. And this concept of a health pit stop at work makes it super easy to get a quick check without messing up your whole day. It's about weaving health into everyday life, not the other way around.
Now, these local strategies are powerful. They really are. But to create lasting change, they need system-wide support. So what does that bigger picture look like? Okay, for all of this to really succeed, it really hinges on three key things. First, we need government policy and funding to make these services legitimate and to pay for them. Second, we need to give pharmacists specific training on how to communicate effectively with men. And third, we need public awareness campaigns to change how people see the pharmacy, to see it as a primary health resource for men. So the next time you walk past your local pharmacy, I want you to see it for its full potential. It's so much more than just a place for prescriptions. With the right strategies and support, it can become a cornerstone in closing the men's health gap and ultimately in building a healthier future for every single one of us.